But it's very interesting because they recently did a study where they followed over 2 million people over 8 years between 40 and I think 69, where they found that people with metabolic syndrome that we touched upon earlier have a 24% higher risk of early onset dementia, meaning before the age of 65. It wasn't a study for causation, but the correlation was huge. And it totally makes sense.
Yes.
Yeah.
And the reason behind that is oxidative stress due to metabolic syndrome, due to metabolic disorders.
Yeah, absolutely. So, the prevention of dementia starts early on, like with everything. People think that I have to wait for a disease to occur in order to treat that disease. No, we have to prevent this disease. We have to take all the steps necessary to keep this body healthy because we only have one and we have one life. I think people lose track of time, or they don't think really that time is priceless. And they think, oh, I have a long time to live. I'll do it tomorrow. I'll start next week. After vacation, after my birthday, after whatever. You don't know. You don't know what you don't know. And definitely one of those is the duration of your life on this earth. And definitely, I don't take time for granted. I treasure it. And health is definitely priceless.
Health is priceless and time is priceless. Yes.
Yeah. These two things, if people would pay attention just to these two things, I think everybody would be so much happier and healthier and everything would work better.
True. Absolutely true. So let's talk about the testing for metabolic. So for those people who go to their doctors, typically, naturally, they check for CBC, they check the basic metabolic profile. Sometimes they check thyroid, not the full thyroid, but only TSH part of it. They do check cholesterol. Again, sometimes not the whole cholesterol, but only LDL, HDL, and total cholesterol, maybe triglycerides. No ratios sometimes they do. Hemoglobin A1C, sometimes they do, sometimes they don't. But it's not only if they do, it's the interpretation. In my opinion, the way doctors interpret upcoming avalanche of problems. That's the problem. In medical school, we were taught if the range is within this, if it's normal, leave it alone, don't touch it. Okay.
Yeah.
But yes, in some cases, yes, I'm a trauma surgeon. I was trained in ICUs and surgical ICUs. And when we're dealing with the patient who is in very difficult conditions, when you really have to watch the electrolytes, you don't play with them. You just, you get them within the range and fine, as long as they're alive. But in the real life, when you're a healthy person, those ranges don't work, right? So for inflammation, we could predict that there is oxidative stress. We could predict that there is inflammation happening. Even if everything is okay, all the parameters okay, the patient is skinny, the patient's saying, yes, I do have fatigue, I have a lot of stress, I don't sleep well, and I have constipation. Pretty much nothing going on, right? Like a normal person. And doctor says, drink a lot of water, I'll see you next year, everything is okay. Or they say, well, your cholesterol is high, just eat some, fat-free food and then come back in 6 months. I'm going to check your cholesterol, and your cholesterol continues to be high. I'm going to put you on cholesterol medication. You see?
Right.
So your thoughts on that?
Yeah. So again, coming from internal medicine, exactly right. So we were looking at ranges, taking that, okay, it's vitamin D, right? It's between 30 and 100. Okay, you're 30, you're good. No. They have, we have to think how those ranges were calculated. And this is from the, different ages, different health level people, and different areas. And you cannot use them, like really from, beginning to, like from the minimum to maximum. Everything has to be in the middle, and it has to be age related and condition related. If you have, I see so many people, right, with liver enzyme they're within normal limits, right? All the transaminases, normal limits. But if it is a 15-year-old with transaminases in the 30s, that is not okay. Or if your liver enzymes are 47 or 50 or something, when the normal range is up to 40, that is not okay. For sure, there is some inflammation of the liver. There is fatty liver. Again, depending on the context, but this has to be investigated. And vitamin D, absolutely. Everybody should, nobody should be less than 60, 70, 80. That would be, at least, that's at least 70 to 80. And all the other blood tests, but we interpret things differently, right? And, high platelet count doesn't mean that only, maybe you had an infection, or maybe, well, let's repeat that and see what's happening, because it could be autoimmune. It can be some inflammatory condition. It can be, it's not anemia, of course. It can be an infection, or it can be something worse. So it cannot be just, discarded. And so many other blood tests are really, we look at them really in the middle, and again, according to the age, rather than taking the absolute range as, all okay. So definitely different interpretation.
Yeah, and let's go back to vitamin D. It's not only the range. I absolutely agree with you. Between 30 and 100, I always tell my patients, they go, but it's 35, it's 40, it's normal. And I go, would you rather have
Yeah.
40 bucks in your back pocket or 100 bucks in your pocket? How would you,
I like
how much
that.
freedom you had if you had more of the, plus also depends what season we're checking you. If I'm checking you and you 35, 40, sometimes, let's say in April in New York, we okay. We just came out of the winter time. We're fine. The sun is coming. We're going to be okay. But if you're starting winter in October with 45, that 45 will turn into 20 or maybe even 15 in February.
Yeah.
You see, so it all depends. So it's important to understand for patients as well. The patient's education is very, very important. Or the same thing with vitamin B12. When I find B12 low, unfortunately, sometimes with the insurance patients, I cannot check the whole B panel. I just only check B12, and if B12 is low, so kind of assume that the rest of the Bs are also probably low. And again, low. Look at the range for B12: 200, 1200.
Yeah.
What is the
but
range?
they say up to 400 it can be, deficient. So, but
No.
okay, then put it in there,
Exactly.
but yeah. So
exactly.
yeah.